Now that we have reviewed searching with PubMed, you should be able to execute searches related to your topic of interest. This implies that you have time to define your topic, construct and conduct efficient searches, critically appraise the evidence retrieved, and apply your findings to your research or clinical practice. When you are in a clinical setting, time is gold. In order to effectively retrieve, assess, and apply the best evidence available, you need resources that offer information ready to use. This kind of information is found in what is known as point-of-care resources. Point-of-care resources refers to ready-to-utilize information for evidence-based decision-making in various clinical settings, but mainly at the point of care with the patient. The information found in these resources are usually comprehensive, periodically updated, evidence-based, and categorized as summaries and guidelines, pre-appraised and non-pre-appraised information. Before we get into the actual point-of-care databases, let's examine the EBM pyramid of resources to understand the types of information out there concerning evidence-based medicine. We suggest you take a closer look at your textbook, User's Guide to the Medical Literature by Gordon Guyatt, available through the medical library as an ebook. Follow with me to view the pyramid in the electronic version of the textbook. From the medical library's homepage, type User's Guide to the Medical Literature in the catalog search box located in the center of the page. Click on the first result, JAMA Evidence. As soon as you click on it, you will find the table of contents and then expand the section labeled The Foundations. Locate Chapter 5, Finding Current and Best Evidence. You want to expand the section titled How Evidence is Processed and Organized into EBM Resources. Here you will find the pyramid and a description of each of the levels located under the heading Pyramid of EBM Resources. Click and expand on Table 5.1. At the top of the pyramid, we have summaries and guidelines. Summaries are regularly updated online resources that aim to integrate the body of evidence at topic level for several related questions. Guidelines follow a similar approach, usually focused on a specific topic or disease. A useful resource to search for guidelines is the U.S. National Guideline Clearinghouse at www.guidelines.gov. The second level of the pyramid is pre-appraised research. When summaries or guidelines do not provide a satisfactory answer, you must look directly at the research findings, first from systematic reviews and then, if necessary, from primary studies. These resources select only systematic reviews and studies that meet defined methodologic criteria and provide synopses, a one-page structured abstract or description of reviews or studies. The degree and quality of pre-appraisal vary across resources. At the bottom is non-pre-appraised research. When other sources have failed to provide an answer, you should search for primary studies in the larger databases such as PubMed or CINAHL. Remember to use filters when searching to limit the number of results when you need to identify the best evidence for your question. Now let us look at the point-of-care resources we offer at FIU. Dynamed is a clinical reference tool created by physicians, for physicians, and other healthcare professionals for use at the point of care. This contains clinically organized summaries on more than 3,000 topics. UpToDate is an evidence-based, physician-authored clinical decision support resource used in point of care. To access this popular resource, you sign in with your FIU username and password. Micromedics offers comprehensive evidence-based resources at the point of care for medication management, toxicology, and disease and condition management. First Consult through Clinical Key is an evidence-based medicine tool with information on diagnoses, medical conditions, procedures, and medical education. Medscape Reference offers physicians and other health professionals integrated medical information and educational tools. It includes review articles, journal commentary, expert columns, patient education articles, book reviews, and book reviews from more than 125 medical journals and textbooks. If you want to search across all databases at once, you can try a federated search, which is a search across all levels of information found on the EBM pyramid. One such resource is the Access database. Access runs parallel searches across multiple databases. Create your account in Access. Make sure that you select FIU as your institution and log in. We will use the example of HIV in our search. Notice the results by the different categories: summaries, synopses, syntheses, synopses of studies, and non-appraised along with the databases. Let us try one. Click on UpToDate. If you click on one of the results, you are automatically taken to the entry. Now that you're familiar with point-of-care resources, you can effectively search the best evidence available to answer your clinical question.